Let us now consider the question. Let's write it down here. What are the indications of antacids? Okay, so what are the indications of using antacids? So in which conditions do we use antacids? So the indications for antacids are intermittent gastroesophageal reflux dyspepsia. Okay, so dyspepsia basically means discomfort, a feeling of discomfort, of bloating, okay, in the upper GIT, upper gastrointestinal tract. So that is called dyspepsia. So intermittent gastroesophageal reflux dyspepsia. Okay. So sometimes this dyspepsia can manifest along with pain. Okay. So when pain happens, we commonly call it heartburn. So why do we call it heartburn? Because if you think about it, you have got the heart, and the pain would be reflected um, somewhere near the heart. Okay? So somewhere there you have your heart. Okay, so you begin to feel the pain somewhere near the heart. Okay, so that's why it's called heartburn. Okay, so obviously, if you burn something, you would feel pain. Okay, so in this case, you feel pain near your heart. So that's called um, heartburn. Okay. So that happens when this dyspepsia is not controlled and there is some bit of erosion. So usually the pain is associated with a fair bit of erosion of the esophagus. Okay. So here we are distinguishing between dyspepsia and heartburn. So dyspepsia usually, in a narrow sense of the word, refers to discomfort and bloating of the upper GIT, whereas the pain is called heartburn. Okay. So whenever there is intermittent gastroesophageal reflux dyspepsia, then the antacids are administered. Um, and sometimes for the symptomatic relief of pain in peptic ulcer. Okay, so the definitive treatment for peptic ulcer, the most potent drug for peptic ulcer is hydrogen potassium ATPase inhibitors. What are these drugs called? They are called proton pump inhibitors. What could be an example? We have many examples like omeprazole, okay, lansoprazole, pantoprazole. So these drugs are basically they are the definitive treatment for peptic ulcer. So, so the problem with these drugs is if you administer this drugs it would take about 1 to 3 days before they become fully active. Okay, before they become fully active. Okay. So in the interim, we could use antacids. Okay? So that's the second indication. The, the third indication is the neutralization of gastric acid to prevent aspiration pneumonia. Okay. So let's look at a condition. So maybe there is a woman going into labor. Okay. So a woman is going into labor. So there is chances that the acid contents of the GIT would get into the respiratory tract. Okay. So when acid contents go into the respiratory tract, okay, so when acid contents go into the respiratory tract, we call this aspiration. So in women who are in labor, they are usually given a dose of antacids. So why is that? To prevent aspiration. So what is aspiration? It is the reflux of the acid contents into the respiratory tract, and that would make the person cough. Okay. So that's not very desired in women undergoing labor. Okay. So the fourth indication is the preparation for endoscopy. So any surgical procedure. So what is endoscopy? Endoscopy is insertion of an endoscope an endoscope which is lubricated to prevent injury, and insertion of this endoscope into the GIT for diagnostic purposes, to visualize. Okay. Diagnostic purposes. Maybe to visualize, example would be to visualize, to check for the presence of ulcers. Okay. So, so if the GI tract contains acids, again there is a chance of aspiration. Okay. So to prepare a patient for endoscopy, antacids are administered. Okay. So nowadays we have got this is not a drug of choice. Antacids are not a drug of choice to prepare a patient for endoscopy. We have got the proton pump inhibitors or the histamine 2 receptor antagonists, so like ranitidine. They are given for preparing the patient for endoscopy. Okay, but, for historical reasons, we have included antacids here. Okay, but that's not the drug of choice. Okay, so now you know. And sometimes it is given for the prophylaxis. So what is prophylaxis? It is prevention. Prevention of stress-induced ulcers. Okay, so stress can cause ulceration. People in stressful jobs, they can have ulceration, and that can lead to dyspepsia. So, yeah, so these are the most important indications for antacids. But remember, the most important indication from the name itself, we know antacids, their job is to prevent acid formation. So their main use would be in the treatment of intermittent gastroesophageal reflux disease. Okay, so we don't want to give antacids for GERD which lasts for greater than 2 weeks. Okay, so the patient at the most should be administered antacids for approximately 2 weeks. So at the end of 2 weeks, the patient should be assessed and checked whether there are more severe underlying problems that necessitates a change of the regimen from antacids. So, yeah, so these are the most important indications for using antacids. And the one at the top is the reason why it is used, the rationale for which it is used currently in the clinic. So that would be the second use for which antacids are used currently. Okay. So the symptomatic relief of pain in peptic ulcer. Why the antacids? Why are they given for the symptomatic relief of pain in peptic ulcer? So we said that the treatment would take, the definitive treatment is proton pump inhibitors, and that would take 1 to 3 days. Okay. So at that point, for 1 to 3 days, the patient will continue to have pain. Okay. So we give a fast-acting drug. So antacids are fast-acting. So in the interim, antacids can be administered to the patients. Okay. So these are the most important indications for using antacids. Before we take the discussion further, we need to remember that the increased acid formation in the stomach could be due to the consumption of alcohol. It could be due to the use of tobacco, caffeine, citrus juices, even stress. So hyperacidity could be due to the consumption of these substances, or it could be due to obesity. It could be a contributing factor. And so one has to remember that before one prescribes antacids to a patient, we should always advocate lifestyle changes. Okay, which may involve reduction of alcohol, stopping the use of tobacco, and it has got lots of other benefits as well. Consuming less of stimulants like caffeine, generally trying to manage the stress and reducing the body weight. All this can have a beneficial effect with respect to hyperacidity. Okay. So before the drug treatment per se is started with antacids, it would be prudent to counsel the patients on these aspects. Okay. Obese people, especially, they are prone to have reflux into the respiratory tract, and that can result in aspiration, and that would make them wake up at night, and that would in turn reduce the quality of life. Okay. So reduction in the body weight would be beneficial in obese patients. Okay. In addition, there could be so obesity is associated with sleep disturbances, aspiration, and all these things can decrease the quality of life. So sleep disturbances like sleep apnea. Okay. Snoring would be associated with obesity. So reduction of the body weight would be beneficial. It would have a very healthy impact on the lower esophageal sphincter as well. Okay, so when we talk about antacids, we shouldn't forget that there can also be lifestyle changes. Okay, so we shouldn't forget counseling the patients on lifestyle changes that they need to adapt in dyspepsia. Okay, and it would be very helpful. Okay. We also need to remember that if you, in such obese people, if you raise the head, maybe using a pillow, that would again help in the management of dyspepsia. Okay, it would prevent in many cases the aspiration into the aspiration of the gastrointestinal fluid into the respiratory tract. Okay. So raising the head again could be beneficial. Okay. And also remember that peptic ulcer, um, one of the causes, so peptic ulcer is of different types. There is uh, uh, a peptic ulcer where you don't find Helicobacter pylori. Um, so peptic ulcer is caused by the bacterium Helicobacter. Okay. So sometimes peptic ulcer is not associated with Helicobacter pylori. When it is not associated with Helicobacter pylori, then the drug of choice is the proton pump inhibitors. Okay? So if at all it's caused by Helicobacter pylori, then the drug of choice is obviously the triple therapy. So we would be covering the treatment of peptic ulcer in a different video. Okay, so when I told you about proton pump inhibitors being the definitive treatment, I meant peptic ulcer where Helicobacter pylori is not the cause. Okay? So just have it as an aside in your mind.